Non-clinical jobs within the healthcare field include a few examples like health information manager. They provide flow management for all medical records. They usually require a bachelor's degree, as well as knowledge of medical terminology and laws. There's also a medical secretary. Medical secretaries work in the medical office performing clerical duties. Office software proficiency, as well as knowledge of medical terminology, is needed. For this position, one usually attends a vocational institute of some sort, but it's not required. Another position that's non-clinical is a healthcare administrator. Knowledge of finance, project planning, and oversight of an entire practice is necessary. They adhere to policies and procedures, and a master's degree is usually required for a position like this. Next, we'll talk about allied health professions. Allied health professions are essentially pillars of the healthcare world. The role of an allied healthcare worker is to provide patient care that is invaluable within medical and nursing and dental fields. Some examples of positions within this profession are medical assistant. They carry both administrative and clinical duties. They perform point of care testing, recording of medical history, and act as a flow manager for the provider that they assist. This position requires an AMA certification, usually acquired from a vocational institute, and etc. Blood bank technology specialists identify blood types, do blood testing, support of providers in blood transfusion therapy. A bachelor's degree in biology, microbiology, etc. are generally required. Home care assistant aide. They are responsible for physical, mental, and injured or disabled patients that are restricted to their homes or to a healthcare facility. They are supervised by a nurse and work with families of patients in regard to the patient's care. There is training available for this position. However, there is no academic requirement to obtain a role like this. Phlebotomists perform venipunctures to process testing for a number of blood tests utilized for diagnosing illnesses, as well as determining medications are working properly. They generally work within laboratories, hospitals, doctors' offices, nursing homes, etc. High school and a training program are required, along with passing a certification exam under the National Phlebotomy Association. Radiologic technician is another position in charge of situating patients properly to get accurate diagnostic images produced via MRI scans, CT scans, ultrasounds, or x-rays. They work closely with radiologists. For this position, colleges and vocational institutes offer accredited programs required to work in this position. Ophthalmic laboratory technicians is another position. They make prescription glasses and contact lenses. They operate machinery to use to cut, edge, and finish lenses. They also insert the frames into the lens into the frame to give you the finished production of the glasses for the patient. They work in laboratories within workshops or within the actual eye shop itself. The skills required for this position are generally learned through the job. Next, we'll discuss LPNs, RNs, and nurse practitioners. LPNs generally check vital signs, perform wound management, and may administer some medications, keeping the patient comfortable is generally the overview of their role. They are supervised by RNs or MDs. Completion of a state-approved program is required for this position. For RNs, they administer medicine, coordinate care, perform physical examinations, to triage and make critical decisions. A bachelor's degree in nursing is required for this position. For nurse practitioners, coordination of patient care, and they provide primary and specialty health care to patients and sometimes carry out a panel of patients. For this position, a master's degree is required.